Hi everybody, my name is Jasmine. I'm a nursing student at JCTC, and today I'm going to talk to you guys about acyanotic heart defects per lecture. So let's get started. So an acyanotic heart defect is exactly what it says. Acyanotic means no blueness. Okay, so they have normal O2 stats. Let me write this down for you so you know. Move my chair because I'm old and sometimes my back hurts. All right, so they have normal O2 stats, okay? Because they're not blue, right? In addition to normal O2 stats, if they have normal O2 stats, how do you think their mucous membranes are going to be, right? Their mucous membranes are going to be pink, right? Because it's going to be normal, okay? Another condition in regards to what an acyanotic heart defect looks like is that they also have, make sure I do this right. Okay, so in regards to their O2 being normal, all, all, all the blood is oxygenated. So why is this important, right? Is every single blood cell in your body oxygenated? No. Why? Because in your regular bloodstream, if you didn't have an acyanotic heart defect, your white blood cells, your right side of your heart pumps deoxygenated blood to your lungs. So, no. But in the acyanotic heart defect, I'm going to get into why this occurs. All the blood is oxygenated, okay? Um, Due to abnormal circulation because it is a heart defect. There's something going on with the circulation of the heart, okay? Now, these are the four similarities between every single acyanotic heart defect. Now, let's get into the first type of acyanotic heart defect, and that is atrial septal defects, okay? All right, you guys, so I'm back again. Had to change my board up. All right, so the first acyanotic heart defect I'm going to talk to you guys about today is the atrial septal defect, or ASD. Now, what's going on? How do you know a child has an ASD? The signs and symptoms of ASD is basically a murmur, okay? Uh, this condition is due to, so why would a child get a almost said it. Why would a child get an atrial septal defect? It's because their foramen ovale did not close when it was supposed to. Right? So what's happening? So because their atrias still have a hole in between them, if that hole maintains being open, what's happening is you have the left ventricle pumping blood into the I'm sorry. When the left side of the heart pumps blood, when it receives blood, when it receives blood from the two pulmonary arteries in the back, that blood is more powerful than the right side of the heart. So what's going to happen is that blood from that left-sided atria shunts to the right atria, right? And then what happens is because the left side of the heart is thicker for a reason, is more powerful. It forces blood more forcefully through to get to the body, right? The right side of the heart, not so much. Okay. So what happens when the opening maintains when the foramen ovale doesn't close, and it's pushing blood to that area, um, into the right atrium, is going to cause the right ventricle to get bigger. Okay. It's going to go from here, and then it's going to go to the right ventricle, and then it's going to go to your pulmonary artery, and that can lead to pulmonary artery hypertension. Okay. Or enlargement too. Too much pressure, too much pressure, too much pressure. Okay. So, this condition can actually lead to heart failure. Now, usually the time frame, the foramen or valley is supposed to close after birth or within 2 weeks of birth, right? But it can take up to 18 months. So the time frame is 18 months. If it is past the 18-month period, that is when they will do diagnostic treatment such as an echo. And on the echo, they will see the whole. The echocardiogram is pretty cool. You can Google what it looks like, what stuff looks like in regards to the heart. It'll show you everything, every structure, major structure of the heart. But it usually clears by 18 months. But if it doesn't clear by 18 months, then they're going to diagnose it with an echo, and then the treatment options are, you can do a cardiac cath. Okay, so the treatment for a ASD or atrial septal defect is a cardiac cath. Now the symptoms usually depend on the size of the hole. If the hole's really small, you really will have to watch for that murmur, that S3 or S4 sound. The bigger the hole, the more pounding you'll hear, or swishing you'll hear. Um, Something I was forgetting to mention in regards to heart sounds. It'll come back to me. But now, most of the time, though, the signs and symptoms of this are asymptomatic, meaning it won't have any symptoms until it starts getting worse. Oh, I was gonna listen. That's what I thought of. Okay, so I forgot to mention this in the assessment video. When you're listening to heart sounds, the best the best area to listen to a baby's heart sound is between the third and fourth intercostal space, which is called Erb's point. Okay, do not forget that. That might be an exam question. Okay, so where do you listen for the heart sounds of an infant? The third and fourth intercostal space, also known as Erb's point. Don't want you to forget that. Um, let's see. Did I miss anything? Okay. Other things we're gonna look for in regards to heart failure: if the baby's grunting, nasal flaring, increased breathing effort, increased work of respirations in regards to uh, retractions and stuff like that. So those are things we're gonna see, and most definitely we're gonna look at their growth patterns too. If they're not growing, that is a problem, because their body's working so hard to deal with this problem, and is literally not really concerned with their growth pattern, because it's using all its energy to help with this particular heart defect, or all of the heart defects in general. And my next video is going to be in regards to ventricular septal defect. It is sort of similar, but it's your ventricles this time. All right, see you in a bit. Hey everybody, sorry again, I had to change my board. Okay, so the next acyanotic heart defect we're going to be talking about today are ventricular septal defects. This defect has to deal with your pulmonary artery, I mean, not pulmonary artery, Lord, your ventricles having a hole in them that doesn't close. Okay, so let's start. So, what is actually going on with a ventricular septal defect? Like I said earlier with atrial septal defects, the blood in your left ventricle is more powerful. So you're having all this powerful blood from your left ventricle enter into your right ventricle, right? It's too much pressure. Okay. And not only that, you have a high presentation um, of oxygenated blood into your right ventricle. So your left ventricle shunts your right ventricle, which then shunts your right atrium, which then causes problems for your pulmonary artery. And on the flip side of this, your left ventricle thinks that it doesn't really know what's going on in terms of where the blood's going, but you're losing the blood to your aorta. So your left ventricle is going to work harder because it thinks that it's not effectively getting blood through, which then results in more problems. Okay. Now, did I just put that in the wrong place? I did. But it's good. All right. So basically, I just talked about it, but they're both enlarged. Okay. I'm going off my little cheat sheet just to make sure I hit all the points. Okay. Now, the signs and symptoms in the lungs. So, which part of the heart sends the oxygenated blood to the lungs? The right side. But since there is oxygenated blood already that's moving from the left side to the right side and not to the body, so the lungs are going to experience short of air, tachypnea, just because there's just too much pressure, too much pressure, too much pressure, too much pressure, and dyspnea. Okay. Now, what other side effects could a child with this ventricular septal defect show? Obviously, they're going to have poor growth and a palpable thrill. Okay. Sometimes, if the baby's tiny enough and the hole is big enough, you may be even able to see it. But when you touch it, you'll feel a thrill when you're just doing your assessment. Other things to look out for is that with poor growth comes poor fluid intake and poor feeding in parts to an infant. Now, the time frame for acyanotic heart defects is usually 4 to 6 weeks. Let me make sure. No, 4 to 8 weeks. Real close. No cigar. So the time frame this usually occurs is around 4 to 8 weeks after they're born. If you do your assessment right, hopefully you catch it before then. But this is the most common overall congenital that causes heart disease. Did I miss anything? Okay. Diagnosis and treatment. So, how are they going to diagnose this? First of all, an echo again. And also, you're going to do surgery and a cardiac cath. Okay. Um, but most of the time, these ventricular septal defects and the atrial septal defects are asymptomatic because they look normal. You really have to pay attention to what is this baby presenting as. Do I hear a swishing? Is it like a very systolic murmur type thing. If it's a systolic murmur, um, it's a ventricular septal defect. You just have to be really diligent in catching this stuff early, okay? And one of the key signs for an infant is poor feeding. So you want to make sure that if you get this, that if you're doing your assessment appropriately, and sometimes you may not catch it, but hopefully when you do catch it, it's able, it's easier to fix it earlier on. It is. Um, nope. And the nursing interventions are the same in regards to ventricular septal defect as they are for tired, as they are for a atrial person, and that would be you're just going to monitor poor feeding if they show signs of congestive heart failure. Uh, how are they breathing, and just monitor their growth patterns. That's it. That's it for ventricular septal defects. The next video is going to go more into patent ductus arteriosus, which is my favorite actually, and coarctation of the aorta. Okay, so I'll see you guys next time. Bye.